ChatGerry, special message. From journals to YouTube, a patient-centered medical communication. Shifting style, preserving mission. Number, No.YT-S016, September 11, 2025. Gerald C. EclaireMD Foundation. Category, background. For more than 10 years, I published my medical research papers in journals. To date, I have written and published over 1,350 papers covering diabetes, cardiovascular disease, chronic kidney disease, stroke, cancer, aging, and more. These works reflect 16 years of persistent study, more than 4 million data points collected from my own body, and the application of research models, such as the Viscoplastic Medicine Theory Energy Model, VMT, and Neural Network AI Modeling, NNM. Over time, I realized that publishing in journals did not serve my ultimate purpose. Academic recognition, citations, or prestige were never my goals. I had already achieved recognition and financial success earlier in my professional career. As an innovator and entrepreneur, what I truly wanted was not fame or money, but the power to influence ordinary people's health and longevity. That is why I decided to change my communication style. I shifted from publishing in journals and speaking at conferences to speaking directly to patients and families through 2 YouTube channels: Health Talk with EclaireMD, for medical professionals, and ChatGerry, for ordinary people, patients, and their loved ones. On these platforms, I use plain English, simple stories, and short, clear messages, which are based on scientific research findings that anyone can understand. This shift reveals several important lessons. The courage to abandon prestige for purpose. Most researchers remain within the validation system of peer review and citations, because it provides professional security. My decision to step outside that system and communicate directly with patients reflects a deeper commitment to saving lives rather than seeking recognition. The mathematics of impact. Over 1,350 papers in journals may reach hundreds or thousands of professionals, but voice-only videos in plain English can potentially reach millions of patients directly. The multiplication factor for potential life-saving influence is enormous. Scientific integrity in accessible format. I am not dumbing down the science. I am discovering, translating, and interpreting it. The foundation remains rigorous data analysis and mathematical modeling with biomedical meaning, but the delivery is different. This balance is much harder than writing either purely academic or purely popular content, yet it is essential for real-world impact. The democratization of medical knowledge. Healthcare has long suffered from a gap between what researchers know and what patients can understand. By speaking directly to patients, I am breaking down this barrier and opening access to knowledge that can prevent complications and deaths, a model for other researchers. This transition may serve as a blueprint for others who want their life's work to have maximum human impact, not just academic recognition or limited financial return from the healthcare system. Rigorous research, combined with accessible communication, is rare but powerful. This is not just a change of medium, it is a reimagining of how medical knowledge should flow, directly, from researcher to patient, bypassing traditional gatekeepers while preserving scientific rigor. My earlier innovations once made me wealthy, but my persistence and medical communication now give me a far more meaningful purpose in life. Recognition fades, but influence on human health and longevity can last. That is the mission I serve every day. Disclaimer: this content is for educational reference only and not medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be edited or republished as your own.